It's always full, always. I've never heard of one person actually going into hospital and getting a bed straight away. Never.
If that was happening in cancer or heart disease, it would be a national scandal, and it is a scandal that we don't have appropriate life-saving mental health care for people with mental illness.
People are being neglected or forgotten about, and it's not therapeutic, it's not helping them, it's just sort of ignoring them.
And I can't even look at his picture. I can't look at him because it hurts so much. And I feel that he was failed.
I survived. Others didn't. And it's not fair. We shouldn't die thinking that we're not worth something.
What do we want? More beds! When do we want it?
Now! Tasmania's mental health system is in crisis.
We'll never be defeated!
Nurses and other medical staff from the Royal Hobart Hospital are rallying outside the state parliament to protest bed shortages.
It's the difficulty of people who have serious mental health problems who are getting holed up in our emergency department too long.
The shortage of psychiatry beds at the Royal Hobart Hospital really happened around about 5 years ago. There was a reduction from 42 inpatient beds to 32. It was strongly resisted by the psychiatry staff at the Royal Hobart Hospital, and we've noticed problems since that time.
The cuts left only 19 mental health hospital beds for every 100,000 Tasmanians. By comparison, New South Wales has almost double that number.
We have acutely ill patients with serious mental health issues being stuck for inordinately long periods of time in our emergency department. I think the record is something like 6 days.
It's so busy, very bright. You can hear people in pain. You can't sleep, and that's the most important thing you need at this time, is to sleep. My name's Teresa. I'm a full-time mum of 4 children, this little one being the youngest. Last year in August, I had what you would call, I suppose, a breakdown, and a big one at that. I went to commit suicide. I got taken to the Royal Hobart Hospital. When I got there, they explained to me that the psychiatric ward was absolutely full. I could either go home or I could wait to see if a bed became available. It took about 4 days before that bed became available. The last night I spent in emergency, I was asked to leave, pack my belongings and go and wait in the waiting room because the emergency was so full. At that stage I thought, what is the point? You know, if I can't get help at home, I can't get help in here, what is the point? So I walked all the way along that highway to that bridge, and I was getting closer and closer, and I thought to myself, there's no point.
What were you going to do at the bridge?
I wanted to jump.
At the Royal Hobart Hospital alone, there have been several deaths attributed to the bed shortage. In 2016, a man who was told there were no available psychiatric beds returned home and killed himself later that day. The coroner found the lack of beds directly led to his death.
Had sufficient beds been made available, it is likely he would not have taken his life.
Later that same year, a young man who was waiting to be admitted to the psychiatric ward killed himself in the emergency waiting room bathrooms. And just earlier this year, a woman took her life while being treated in the general service unit of the psychiatric ward. Days earlier, doctors warned overcrowding could cost lives.
We're faced with a heavy patient load of people who need a lot of care and support that we just don't necessarily always have the staff to cope with. So people are being neglected or forgotten about, and it's not therapeutic, it's not helping them, it's just sort of ignoring them. In essence, helping the condition become a bit worse before we can really start actively treating them on the ward, because it's not a therapeutic environment at all.
Michelle is a psychiatric nurse. She knows firsthand just how dangerous bed shortages can be. She says private mental health clinics are part of the problem.
If a patient is seen to be an acute risk to themselves or dangerous or agitated in a manner that the private system doesn't believe that they can cope with, they will just refer them on to the emergency department.
I can't go nowhere. My children need me. I want people like myself, you know, to realise they can ask for help and they can get help. But it takes for someone to get hurt before someone listens. And it shouldn't be like that.
Experts say there are two critical shortages. One is the lack of psychiatric beds in public hospitals. The other is adequate community-based mental health clinics.
But there's nothing between the GP and the specialist acute care. So just building a whole lot of new beds, that'll just take us back to the 19th century when we had institutions. So we need community mental health services to turn off the tap, because there's just a flow, there's a tide of people coming into emergency departments looking for beds and appearing to need admission, whereas if they'd been looked after properly in the community earlier, then they wouldn't have presented in the first place.
Tasmania has the second highest youth suicide rate in Australia. Despite this, it has no dedicated psychiatric wards for children and adolescents. The nearest facility is in Melbourne. And advocates say that local services in Tassie are so stretched, young people are falling through the cracks.
Christopher was 17 and he died on the 1st of April 2016.
Diane lives in Somerset, which is about a 4-hour drive north of Hobart.
He was a beautiful baby and he was very loving and a cuddly baby. He was beautiful. And this one I love. This is so cute. But it's really bad now that he's not with us. When he was about 14 and 15, he started to change. He got very withdrawn. He stayed in his room. And I think that he might have had a bit of trouble at school as well, a bit of bullying.
Christopher was put on medication and referred to a community-based mental health service for children and adolescents where he saw a string of fly-in and fly-out psychiatrists.
They'd stay for a while, then they go. So every time he saw a psychiatrist, they'd put him on medication, then they leave. Then they get another one that comes in and, oh no, we don't want him on that. Then they take him off the tablets like he went cold turkey. And then he just went right down, hit rock bottom, and then he started doing things to himself.
He tried to kill himself 3 times. Increasingly desperate, Diane tried to get Christopher admitted into a nearby adult psychiatric ward.
Because I was worried, I was scared. And they turned around and they said, sorry, but there's no beds. We can't do it. And then I said, well, can you put him in hospital? He needs to go somewhere. Can you put him in hospital? And they said, no, we can't do that. And I feel like I was just really let down. And that's after that he did it. He killed himself. Coming across and seeing it, it's taken a long time to get that image out of my head. It's just the worst thing that you can come across and see. It's like my world went just black and like ice straight through my backbone, straight through my body. All I wanted to do was to be with my son. And I still find it hard. And I miss him so much. And I feel that if there was more help, he would have been still here. And I love him so much.
The neglect of youth mental health or adolescent mental health is a form of self-harm that the society inflicts on itself. And that's what's happened. There's been a serious underinvestment, especially around adolescents and emerging adults. And we need strong, proactive community mental health hubs which have expert mental health professionals, drug and alcohol, mobile teams, all of the things we know work in preventive mental health care for serious mental illness. I haven't seen any real evidence yet of this issue being taken seriously by the government that has been elected.
Tasmania's Health Minister declined the Feeds request for an interview, but said this in a statement.
We will continue to deliver and improve services over the next 6 years, including 25 new mental health beds and specialist inpatient child and adolescent mental health facilities in the north and south of the state.
But Dr Nicholson says urgent action is needed today.
We have a problem that needs to be addressed right now, and it needs to be substantially more beds than we have at the moment, and we haven't yet got that commitment to fund that and to develop that facility.
How optimistic are you about that happening?
I'm more determined than optimistic.
He needed a place where children could go. He needed a proper psychiatrist where they don't swap and change. And I think that if he had that support where they had somewhere to go for children, it would have helped a lot. And I feel that the government has let us down as well. And I still think that they should be ashamed of themselves.